Hi, I'm Dr. Dumas.
I'm Jack.
Nice to meet you, Jack. Today we are going to be doing a full spine analysis from the base of your head clear down just below your belt line. If I need to expose any areas of skin, is that going to be okay with you?
Yes, sir.
Alright, will you please remove your shirt for me?
Sir.
Check the table here. Alright, I could have you take a seat here facing the TV.
Yep.
Alright, I could have you lay face down for me. Alright, so I assessed his right SI joint here. My contact point was his PSIS, and then from there I just went medial to this groove between the ilium and sacrum. I contacted his ASIS, and my line of drive there was from anterior to posterior. With that, I felt a restriction on flexion. From there, I grabbed his leg, lifted superiorly to check his extension. I felt no restriction there. All the time I had a contact point in the groove between his ilium and sacrum. After that, I did check internal and external rotation. I found no restriction there. Alright, so now we're going to continue our general scan and assess the lumbar and thoracic areas of the spine. Go. And then you put your arm behind your back for me. Behind your back. Thank you. Alright, you can go ahead and bring that forward. And go ahead and give yourself a big hug. Alright, have you put your arm behind your back one more time? Just this one here. Alright, and big hug one more time. Okay, so following up assessing the lumbar thoracic area of the spine of this patient, lumbar spine seemed fine, good springy end feel. As I moved to the thoracics, I noticed a not so springy end feel in the T6, T7 segment. I decided to further evaluate this segment, took the patient into flexion with the contact point of my fingers in between the spinous processes. They did not separate, so he has a flexion restriction. From there, I did lateral rotation. While I did that, I used my contact point with my thumb on the side of the spinous process, pushing lateral to medial. After that, with that I found a right rotation restriction. From there I did right and left lateral bending, same contact point, thumb on the lateral aspect of the spinous process, flex the patient laterally and push through. I found a right lateral bending restriction there. After that, I assessed the ribs. My contact point was the inferior aspect of the angle of the rib during flexion, and during extension it was the superior aspect of the angle of the rib. And his ribs checked out good, both had nice springy end feel.
What direction were you pressing for the evaluation of elevation of the ribs?
For elevation of the ribs, I was pressing from inferior to superior for flexion of the ribs. For extension, I was pressing superior to inferior. Alright, so now we're going to continue up the rest of the thoracics. And from there we're going to check his cervical spine as well as his occiput. Alright, I'm going to have you lean back on my leg here. Actually, I'm going to have you scoot forward on the bench. Alright, lean back. I got you, don't worry. Just relax. Alright, go ahead and lean up for me. Alright, so my line of drive, as I transferred up the thoracic spine, I was P to A at the whole thoracic spine. At the beginning I was slightly more I to S, and then as I moved my way up to the upper thoracics, I was more S to I. As I got into the cervical spine, I contacted his articular pillars, continuing to press posterior to anterior. Lower cervicals, I was more S to I, and then as I worked my way up into the upper cervicals, I was more I to S. I found no restrictions in either of those two areas. As I got to the occiput, my segmental contact point was the mastoid process, just underneath the mastoid process and holding the patient's head. I assessed his occiput flexion, extension, rotation, and lateral bending. I found a restriction in left lateral bending as well as left rotation and in flexion.